And are you going to do an introduction, or you just want me to jump right in? What do you want to do it?
Yeah, I'll do an intro. Thank you, everyone, for joining us today. My name is Gabe Rudeau. I'm the project coordinator here at Empower Idaho. We are a statewide program that promotes mental health, resiliency, and recovery through educational activities, awareness campaigns, and community involvement. We're here today with Amy Walters, who is the clinical health psychologist and director of behavioral health services at St. Luke's Humphreys Diabetes Center here in Boise. And she is here to talk to us today about how psychosocial factors can help or hinder diabetes management and to teach us healthy ways to cope effectively with diabetes. I have muted all the microphones, just FYI. If you want to communicate, we're using the chat box function. So please use that. And I will pass it on to you, Amy. Thank you so much for presenting today.
Great. Thank you so much. It's a pleasure to be here, and hello, everyone. I'm excited to be able to speak with you today about diabetes and the impact psychosocial factors have. This is the topic that's near and dear to my heart, and I hope to bring you some good new information today and strategies that you can use yourself personally or share with others you may know who have diabetes. So as Gabe mentioned, we have some objectives today. We want to be able to identify the impact of psychosocial factors on diabetes. I'd like to help you learn to understand the importance of support for behavior change when you're working on managing diabetes, and then learning some practical strategies to help kind of cope effectively with diabetes. In the beginning, it's always important for us to level set and make sure everyone's understanding what we're talking about when we use the term diabetes. So in general, there are two kinds of diabetes: type 1 diabetes, which was also historically known as juvenile diabetes, and this is actually an autoimmune condition. And the other type of diabetes, type 2 diabetes, is a metabolic condition. So these conditions vary quite a bit in their physiology, and we'll talk just a minute about that to help people kind of understand those differences. With all types of diabetes, we have an issue with the body and insulin use. So in type 1 diabetes, the body actually stops making insulin or can't make enough. In type 2 diabetes, people are able to make enough insulin, but then at some point the pancreas kind of poops out and the cells become very resistant to insulin. Insulin is an important hormone in the body. It's required for cells to use our glucose as fuel. So this is the fuel for the entire body and all of our important cells and functions. So it's critical for overall functioning. One of the things that happens in diabetes is that because insulin is not working effectively, blood glucose levels become way too high, and this can cause damage to various bodily systems. Unmanaged diabetes leads to a number of very serious complications, including vascular disease, both micro and macro, nerve disease, which leads to issues with neuropathy or amputation, and then also kidney disease, eye disease, and can lead to death if it's unmanaged. I want to show you just a couple of brief slides that focus a little bit about the physiology of diabetes to understand the two different types. So with type 1 diabetes, we have issues with the beta cells in the pancreas. This is an autoimmune reaction where those cells are no longer able to make insulin. So the insulin that's needed in the blood vessels doesn't get there. This cranks up our glucose levels, and the muscles are not able to get the glucose they need to fuel the body. As a result, glycogen and proteins start breaking down, and this causes ketoacidosis and leads to extreme illness and weight loss, which we typically see when type 1 is just diagnosed. In type 2 diabetes, things are a little bit different. The stomach converts food that we eat, primarily carbohydrates, into glucose. The glucose enters the bloodstream, and then ideally the pancreas is producing enough insulin to be able to transfer that into the cells. But with type 2 diabetes, the cells develop insulin resistance, which then creates a need for more and more and more insulin. It cannot enter the body effectively, and so the glucose starts to build up in the bloodstream, which then causes the high glucose levels and the damage to the different areas that we discussed earlier. So when we talk about treatment for diabetes, this really becomes a balancing act between taking the proper medication that's needed to deal with the insulin resistance or to provide the body with the insulin that it's not getting. Exercise is a very important part because this helps manage our glucose levels. It helps reduce insulin resistance and bring blood sugars down. And then the dietary piece, which is what everybody discusses, because we need to make dietary changes so that we're not getting too many carbohydrates and too high glucose levels. So it becomes this balancing act between these three factors. And it's a juggle. So how do psychosocial factors impact diabetes and these various components? We actually see a number of areas of impact. When we talk about diabetes, we typically focus on the physical factors. We talk about blood sugar levels and medications and eating differently and moving our bodies differently to manage the physical piece of diabetes. But there are also a number of other areas of impact when we talk about diabetes. One which people talk about frequently is the financial impact. This is a really expensive disease to manage, and many of our patients struggle to be able to afford their medications, their test strips, their insulin, their different oral agents that they're using to control their diabetes. So this has an impact on the individual and on the family. Diabetes can impact career, having to test your blood sugar throughout the day, needing to excuse yourself to take insulin. For parents of kids with diabetes, they may need to miss work because they're taking care of their child and their health needs. So this can have a significant impact on career. We see a mental impact with diabetes and an emotional impact. We know from research that when glucose levels are high, we may not see proper functioning when it comes to memory and attention and concentration. And even when glucose levels are changing from high to low, those higher levels of cognitive functioning are significantly impacted. So this can create a negative impact on kind of cognitive functioning. Emotionally, people with diabetes oftentimes struggle with mood variations. They may experience more irritability. We see higher rates of depression and anxiety among people who have diabetes. And just dealing with chronic illness can be very exhausting. Glucose levels also create changes in emotion, and oftentimes our patients with type 1 will complain that others say that they're moody because those high glucose levels or low glucose levels can definitely impact emotions. Then we have the social functioning. When you're watching what you eat, you're trying to change eating habits, you're trying to be more active and change behaviors. This may be different than what your friendship groups are typically doing. Sometimes our teens will talk about feeling isolated and alone, that others don't understand what it's like to have a chronic condition like diabetes. And so we can see a social impact. And then finally, this impacts the family. When one member of the family is trying to make lifestyle change, is dealing with chronic health issues, there's definitely a ripple effect that impacts everyone. So in treating diabetes, we want to be aware of these different areas of impact because these can either be supporting factors and help that individual, or they can be factors that get in the way. So this is important for us to assess and make sure that we're providing support across these areas. So why do psychosocial factors occur? Well, when you think about the comments on a daily basis that the individual with diabetes receives from others, take your medicine, did you take insulin? Have you tested your blood sugar? What did you eat? How much did you eat? Why did you eat that? You need to have more, you need to have less, so on and so on. There's this constant barrage of comments from other people in their environment that becomes a real source of irritation for people and can actually further impact that emotional state. As I mentioned previously, we see higher rates of depression and anxiety among people who have diabetes. Estimates from research are 30 to 40% of individuals with diabetes will experience a significant level of anxiety or depression at some point during their illness. People will report ongoing feelings of isolation, that they feel different than other people. They become discouraged because diabetes is a difficult disease to manage, and we can see that that creates some frustration. Sorry, my mic fell. And sometimes a sense of hopelessness and helplessness, like I just can't seem to get this under control. Is it ever going to end? I just don't know that I'm ever going to feel in control of my health again. And when people start to feel ineffective, that can lead to patterns with feelings of depression and anxiety. Sometimes our patients feel like their diabetes rules their lives. It's not something that they can just take a pill and get away from. Each day, all day, as they're making choices about food, as they're making choices about activity, they're reminded of this chronic condition, and that can be very frustrating. And then people will often struggle to find this balance between juggling the demands of their diabetes with their social life, their family responsibilities, their emotional impact, their occupation. They feel like they're in this constant tug of war between these two things. So as we start to look at that, we can understand why these psychosocial factors have such a tremendous impact on diabetes management. We also talk about the ominous 8 or the ominous octet in diabetes. When we're discussing issues with anxiety and depression, one of the physiological impacts that we see with diabetes is a certain level of neurotransmitter dysfunction. Neurotransmitters are an important piece of mood management, and so changes in serotonin levels, dopamine levels may be affecting the mood as well, which creates that higher rate of anxiety and depression. I want to pause there for a second and see if anyone has questions. I want to make sure we can address those during our talk today. So feel free to enter anything in the chat box as we go as well, and I'll try to keep an eye on that and address those as we go. So I want to talk a little bit more about diabetes, especially with individuals who have chronic mental health issues. We actually see a 60% increased risk of diabetes for individuals who have depression. So this relationship tends to be bidirectional. If you have diabetes, it can impact depression. If you have depression, it can impact diabetes. Also, for individuals with schizophrenia, we see a 2 to 4 times higher risk among people with schizophrenia for diabetes. And part of this has to do with impaired glucose tolerance and issues with insulin resistance that are common among individuals with schizophrenia. We see that co-occurring rates of diabetes with mental illness may actually increase risk factors and costs of treatment. For these individuals, we often see a lower quality of life. There may be poorer issues with treatment adherence. They may struggle more to obtain glycemic control and increased rates of ER visits and hospitalizations. We also know that some of the psychotropic medications that are used to treat various mental health issues may increase issues with weight. And the more weight we have, typically the more issues with insulin resistance develop. Those specific medications are listed there below for you. So we want to just keep an eye on that. And if you do have diabetes and are taking one of these medications or working with an individual who does, it's important to just discuss those factors with their prescribing provider to see if that's the best medication choice or what to do about those issues. So what can we do to improve our diabetes outcomes and coping altogether? Well, first of all, successful adjustment to diabetes diagnosis and management is all about change. We have to make changes to our behavior. We work here at the Diabetes Center, we work with people on making lifestyle changes, learning how to eat differently, learning how to become more active. It's about dealing with those changes in emotion. We know that the irritability can be a part of high blood sugars, that anxiety and depression are common artifacts, and so learning how to cope with those more effectively. And then we want to pay attention to our thinking patterns, because as we're going to discuss today, mindset plays a significant role in outcomes. People who have a more positive mindset are going to have better outcomes and be able to stay motivated, versus if we get into negative thought patterns, that tends to contribute to more difficulty down the road. So behavior change is required to meet all the other treatment goals that people with diabetes are asked to do. Changes in diet, changes in exercise, following a new medical regimen, doing healthy lifestyle. But unfortunately, we often give these recommendations, but don't provide support for it. It becomes the elephant in the room where people are asked to do things, but they have no idea how to do it. So what happens is they come to my office, and one of the most common things that I hear from patients is, I know what to do, I just have no idea how to do it. And so I feel frustrated, I feel like a failure, and so I give up and I go for the chocolate or the pizza or the chips, whatever my go-to food is when I'm feeling distressed. And this creates a real sense of learned helplessness, and also can really create a nosedive for motivation. So we want to make sure we're providing our patients with diabetes with adequate support for learning how to make these behavior changes. Why is this important? For one, when we research health change, one of the things we find is that health information is necessary for change, but typically not sufficient. Patients need more direct support, not just the information on what they need to do, but help with how to do it. We see that 90% of patients who are successful in weight loss have some amount of regain over time. This becomes very discouraging for people. So working with a professional who can help them identify patterns of how to effectively change their behaviors to maintain that weight loss is really important for long-term health. We know that 50% of patients who relapse with weight loss may experience feelings of depression. So this is an important risk factor that we want to be attending to. As I mentioned previously, we see that psychosocial factors are inherent in diabetes and are important targets of treatment. So mental health professionals become a very important member of the diabetes care team. Here at the Diabetes Center, my sole role is working with individuals in our clinic to help support behavior change, teach coping, and deal with the anxiety and depression that often results. So how do we live well with diabetes? This sounds pretty overwhelming and there's a lot to do. Well, really, there are three main factors. The first is helping support that behavior change by creating healthy habits, dealing with negative emotions, and then changing mindset to be a little more positive. We want to maintain motivation and help build resilience, and then help with coping and stress management. So anytime we start to embark on a change process, it's very important for people to understand that change is a process and it doesn't start with action. For any of you who have gone hiking in the Sawtooth, this picture may be representative of your experience. In the beginning, you're thinking about it, you're not quite sure what you want to do, so you decide, well, I think I'll give this a go. And then after that first mile, you're like, wow, this is really difficult. This is harder than I thought it was going to be. So you have to kind of work through, and then finally you reach that summit and decide it's worth it. And this can be a similar process for people who are adjusting to diabetes or chronic disease. We know from studying change that there are actually 5 stages in the change process. And as I mentioned, action is not where that starts. It starts with a state of pre-contemplation, which means we may not even be thinking about change yet. Then something happens in our life. Perhaps we go in for labs and our provider shares with us that, hey, we noticed that your glucose levels are high and it looks like you have type 2 diabetes. So this is suddenly on the radar. Now the individual moves through a state of contemplation. They need to think about that diagnosis, what this means, what this will mean for their lifestyle, how things might need to change, how they feel about that. And then when we look at anyone in a stage of change process, the majority of people are still in that state of contemplation. I'd say 80%. One of the things mental health professionals can do is help them move through that contemplation phase to actually move to a planning phase where they can start looking and talking about, what would this look like for me? How can I do this? What steps might I need to take to actually start making some of these changes? Then we can move to action. And then we have to maintain that change or we fall into a state of relapse. Relapse is a very important part of the change process, and it's important that people are prepared for this and know what to expect. Once we make that change, maintaining it is difficult, and relapse is a common part of change. So having that understanding, having that awareness, and being prepared to deal with it is very important. Having our expectations in the right place can be key. What people expect when they are working through a change process is that they're going to start at the beginning and make this lovely upward forward progress. And what we see is that's not what happens. People tend to do pretty well in the beginning, and they kind of get going, and then something happens and off they fall. And then they get back on track and they do pretty well for a while, and then down they fall again. There's still forward progress going on, but it's definitely this state of ups and downs. So understanding that can be critical for maintaining motivation. So what are some strategies that we find helpful for actually making this lifestyle change? One is having your expectations in the right place. Oftentimes people have spent years, even decades, engaging in certain behaviors. They're very habitual, and it's important to remember that this has taken a long time to develop, and it's going to take some time to change as well. So taking baby steps, setting very realistic goals. We don't get there with one big leap. We're going to get there with one little step at a time. And so providers can help patients understand this by asking to make one small change at a time, whether it's an eating habit or increasing physical activity, so we can experience some success and then move on to the next one. So picking one area at a time, setting a concrete plan with a specific goal, using our SMART criteria so that it's specific and measurable, actionable, realistic, and time-based. And then we want to record our progress and check in. Self-monitoring can be a really important tool for making change. Just by writing it down and keeping track, we are much more accountable, and that tends to help people stay engaged and stay motivated. We want to practice healthy stress management skills. Stress is an enemy of diabetes. When we become stressed, and we'll talk about this a little bit more later in the presentation, it creates a change in our hormones and can actually increase our glucose levels. So it's important to have strategies identified for how to deal with stress in an effective way. We always want to acknowledge and reward success and try to problem solve our difficulties, and then be patient and stick with it. This is an important process that's going to take time, and it's okay to have ups and downs. It's often helpful to focus on our health and well-being, not just the areas that we're struggling in, but what's important to us. Tying our goals to our values helps keep us motivated and engaged. We want to know what is it that I really want? What is it that I need? What's important to me? What's going to help along the way? What's going to happen if I'm struggling about whether or not to do this? Looking into, well, what if I don't make the change? Am I okay with those outcomes? Am I okay with the trajectory that my health is on if I don't make any of these changes that my provider's recommending? And then what are my life goals and values, and how does my health fit into that? What small steps can I take to achieve those and start moving in that direction of better health? This really is a tricky juggling act. And as I mentioned, with diabetes treatment, we have this juggle between diet and activity and medication. But the foundation of this is really our mindset. And if we've got our mindset in a positive place, it's going to make those changes much easier than if our mindset's in a negative place. We see this definite connection between thoughts and feelings and behavior. Cognitive behavioral therapy is based on this foundation, that our thoughts create a lens that we perceive the world through, and that's going to absolutely impact how we feel and then how we behave. We see this with depression, we see this with anxiety, and we see this with diabetes management as well. So thinking about your own health or a person that you're trying to help, how do you see the glass when it comes to your health and diabetes? Is it half full? Is it half empty? Thinking about mindset, we can definitely fall into that more pessimistic mindset. Chronic disease is difficult to manage and can be overwhelming for people, can suck us right into that. So some of the thought processes that I'd be looking for in that case are those beliefs that this is just too much, it's too hard to change. Sometimes I'll see patients who say, gosh, no one's going to tell me what to do. I'm going to eat what I want, which really sets up kind of this negative dynamic for them. Other times people will talk about, you know what, I feel fine, it must be fine. I don't really believe anything's wrong, or else I'd feel a little bit different. Oftentimes, patients with diabetes will experience issues with pain. They may be having neuropathy as a complication of their diabetes. And we can develop a belief set that if I have pain, I can't exercise, which is actually very counterintuitive. Exercise tends to be one of the important treatment factors for managing chronic pain. Sometimes people just feel like, you know what, what's the point? I just don't want to bother. And all of those mindsets create feelings of discouragement and frustration. They tend to lead to avoidance behaviors. So people then disengage and don't want to participate in their treatment regimen that the providers have recommended. If we can identify those, if we can have people start tuning into those thoughts, paying attention to what's going on, and when they notice a negative mindset, shifting that to something a little more optimistic. Things like, you know what, this is going to be hard, but I can do it. I can make one small change at a time, and every little bit of change is going to help. I may not give up everything I love, but maybe I can start with my sweets intake and reduce that. Even if I can cut that in half, that can make a dramatic difference in terms of my glucose levels. When people struggle with testing, one of the things that I hear oftentimes is how, it takes too long, it's too much of a burden. And yet, if we do a little experiment and actually kind of time with a watch, how long does it take to test? People find it typically takes less than a minute. And when we look at their values and how important health is, they can start to recognize that, wow, maybe a minute now is definitely worth saving a lot of time later in having health issues. Being able to talk to themselves about they're not in this alone. There are many people out there with diabetes and they're managing it effectively. They can find support and assistance if they need it, and really developing this sense of belief that this is something that you can do. All right, let me pause for a second and see if there's any questions in the chat box. And I'm not seeing anything on my end, so Gabe, if you're seeing something, please just speak up and let me know. So let's talk about stress for a minute, because stress is a really important part of healthy diabetes management. We can define stress in a lot of different ways, but one generally agreed upon definition is that stress occurs when the demands of the situation exceed our perceived ability to cope. They exceed those resources that we have. And those resources might be time, they might be energy, they may be finances, it may be understanding, but we're in this state where the current demands of the situation just are clearly exceeding our ability and resources to deal with it. There's definitely a connection between stress and health. Research estimates that up to 75% of primary care visits are actually related to physical problems connected to stress. So being able to manage stress in an effective way is going to be important for our overall health. Many people aren't aware that there are multiple physical symptoms and physical systems that are impacted by stress. Our cardiac system, our immune system, respiratory, endocrine, musculoskeletal, gastrointestinal, and reproductive systems are all negatively impacted by stress. Patients with diabetes specifically will experience an increase in glucose levels just from stress. So we look at studies that measure stress level, and when people rate higher levels of stress, we actually tend to see a peak in their glucose levels. And that's due in part to the stress hormones of cortisol and adrenaline. And we know that high levels of persistent stress are going to have a negative impact long-term on both physical health and emotional health. So it's important that we're prepared and learning strategies to deal effectively. So this is just a quick summary slide that identifies the different areas of the body that I mentioned before and how stress impacts them. So just by managing our stress more effectively, we can have a positive impact on GI system, cardiac system, reproductive system, immune function, and so on. This slide points to some of the physiological changes that happen when we're in a state of stress. So when we perceive some kind of threat in our environment, some kind of a stress response kicks in, the sympathetic nervous system reacts with fight or flight response. We see the pupils expand, we see an increase in heart rate where it starts to pump and we start to breathe more rapidly, digestion shuts down, and all the muscles in the body activate. So this is what we call a stress response, and we can start to understand how, if we're doing this over and over again, day in and day out, this is going to create some wear and tear on these body systems. Luckily, our body has an alternative system, the parasympathetic system, which is the body's calming system. And this system is going to help deactivate us. When the danger is gone, the parasympathetic nervous system can kick in, the pupils can go back to normal size, we can slow the heart rate, slow the breath rate, digestion can kick back up, and the muscles can relax. So part of what we do in stress management is teach people how to activate this parasympathetic nervous system or this calming response. And we can do this in a number of different ways. We can start with the mindset piece, as we discussed before. Having realistic expectations is an important part to help avoid stress in the first place. But other things that we can do are things like exercise. Physical activity is a great way to reduce stress and a great way to help manage diabetes. We can teach people visualization, where they learn to relax and create a visual image of a relaxing place, taking a mental vacation. Good nutrition plays an important role in healthy stress management. Having hobbies that we enjoy. Some of the literature here talks about flow activities, or activities where you can kind of lose yourself, lose your sense of time. Those are great activities to engage in to help reduce overall stress. Being patient, laughter, engaging in activities that you enjoy, spending time with friends who are supportive, having fun can actually activate that parasympathetic nervous system and help calm things down. Spending time with pets, listening to music, time outdoors, just simplifying our life. All of these really basic strategies can have a significant impact on our overall health and our diabetes management. So it's important that we practice these regularly. So we've talked a little bit about stress. Let's talk a little bit about changing habits. When I work with people here at the center on changing their behaviors, one of the things that we talk about is this behavior pyramid, where there are different elements to a behavior. There's the behavior itself, which is kind of the doing part of it, but there's also an affective or feeling piece of it. There can be a cognitive or thinking piece of it. And then all of these things happen within the context of an environment. So we can look at each of these areas to help us identify factors that may be getting in the way and things we can change to help improve our chances of changing those habits. Let's start with affect or emotion. Feelings are a very powerful motivator, and they often drive behaviors. So getting tuned into this, if you're trying to change a behavior and struggling, can be important. Asking yourself when you're in that situation, how do I feel? How strong is this feeling? How am I coping with this now? And is this a helpful strategy? Is this helping me get me where I want to go with my diabetes management? Or do I need to identify alternative ways for dealing with it? One example here might be emotional eating. I work with many people who turn to food when they're feeling stressed or sad or frustrated, and that pretty quickly sabotages their diabetes management. So figuring out what are the times that you're engaging in snacking you're not intending to, how are you feeling during those times, and can we find other ways to deal with those emotions? Coming up with a top 5 list of, as soon as I feel stressed, I'm going to do XYZ before I turn to food. Something like yoga, meditation, visualization, taking a walk, listening to a song, spending time with a pet. Any of those things can disrupt that behavioral habit and help us use a more effective coping strategy. It can be helpful to understand the behavior itself. So actually tracking and figuring out, what am I doing when this occurs? What time of day does it happen? Where am I? How am I doing it? What need does it seem to be meeting for me? All of these factors can be clues into triggers that may be creating this behavioral habit. If we can recognize what these triggers are, we can change it up. One example here would be the habit many people have of eating while watching television. Pretty soon the brain makes a connection between those two things, and every time we go in front of the TV, we get a hunger response that we want to eat. If we can start tracking that pattern of snacking and recognizing, wow, the majority of the time when I'm wanting a snack is when I'm sitting in front of the TV, we can change that up. We can start new habits where, okay, each time I in front of the TV, if I want a snack, I'm going to turn off the TV, I'm going to go into the kitchen, I'm going to sit down at the table, I'm going to have a healthy snack, and then I can return to the TV. Those kind of strategies, breaking those unhealthy associations, can be helpful in building healthier habits. As I mentioned previously, mindset is important. So tuning into those thoughts, really paying attention. If you're struggling with your diabetes management, what are the beliefs I have about this? What kind of thoughts kind of creep up for me when I'm feeling discouraged or frustrated with my diabetes? What do I say to myself? Really identifying what that self-talk might be. Starting to keep a journal about that can be one helpful strategy and way to kind of tune into that. What kinds of expectations do I have for myself? One of the things that we talk about here at the Diabetes Center is that there's no perfection in diabetes. This is a very intensive disease to manage. And so recognizing that you're not going to be perfect, we want to, like when we're playing darts, we always kind of aim for the bullseye, but we don't expect that we're going to hit it every time. Instead, we take that information, and if we're kind of up here, we can move down a little bit. If we're over here, we can adjust this way. But the important part is that we stay engaged and keep playing. Looking at our thoughts and recognizing, are we setting realistic expectations for ourselves? Are these thoughts helpful, or are they more pessimistic in nature, and are they sabotaging our efforts? And is there a more constructive way I could talk to myself? One great test is to ask yourself, would I talk to a spouse or a friend or my child this way? And if not, maybe I need to talk to myself a little bit differently. Being an encouraging coach rather than a critical player is an important part of this. I always like to talk about the environment as well, because this can actually be one of the easiest things to change and one of the things that people don't think about. Our environment creates a platform for everything else, and this can either really support or sabotage our efforts. So looking again at, when does the problem occur? When am I struggling most? What's the time? What's the place? Who am I with? What are the conditions? I want to look for patterns to help give me some information about what might be going on. I want to look at my support system. We know that people who have healthy support systems of people who are supporting their goals and engaged are going to have better outcomes than people who are spending time with individuals who are engaging in a lot of unhealthy habits that kind of pull them in. Looking at the times that you're most successful. Most people have times they do really well and other times they struggle. Learning the differences in those times can help you identify what kinds of things help me versus what kinds of things hurt. And then how am I setting up my environment for success? For example, if I'm working on changing my eating habits, what am I putting into my grocery cart in the first place? It's a great exercise before you check out to actually look down at the cart and say, okay, how many of these are healthy choices versus how many of them am I going to have to battle later? And is this worth it to me? Do I really want to have the bag of chips and the soda and the candy in my cart? If I say no at the grocery store, I only say no once. If I bring it into the house, it can be a real battle. If you do have treats around the house, making sure that they're out of sight, that helps keep them out of mind, versus if they're on the countertop, every time you walk by, you're going to want to take some. So just thinking about those simple strategies of how to improve that environment and make that healthy choice the easy choice. Overall, I like to talk about kind of 5 keys to success and wellness when dealing with diabetes. We talk about the 5 brass keys that can kind of help maintain motivation and resilience. One is balance. As I mentioned before, there's no perfection in diabetes. You're not going to be able to do it to that level. All the information, all the goals, all the time. So we want to make our best effort. Moderation is key. If there's something you're working on changing eating habits and there's a treat you really want, having a small portion, incorporating that into your meal plan can be a much more effective way and a much more sustainable way of dealing with it than trying to totally avoid some of those higher carbohydrate foods. We want to be realistic in our expectations and goals. Diabetes is the marathon, so we don't want to burn out early. So setting small, realistic goals that we can meet along the way and make little improving steps of progress each time is important. We want to have a good attitude. We want to let go of our perfection, try to be objective and look at the data when you're struggling, gathering that information. Surround yourself with caring individuals and take a caring stance with yourself. This is hard work. And then being optimistic and knowing that this is something that you can do. Gaining support, both personally or professionally, is really important. This is a lot of change that we're asking people to do. So having people in your life who can encourage you and support you, and then seeking professional assistance if it's something that you're struggling with. And then, as we mentioned, having a plan for stress, learning how to cope effectively and manage those stressful emotions so that they don't get in the way and create physical health problems. So take-home points. Psychosocial factors have a significant impact on diabetes. We know from the biopsychosocial model that all of these things are interrelated. So paying attention to the psychosocial components can help you be more successful down the road with your diabetes management. I want you to think about your health in a system context, knowing that you're part of a family, which is part of a community, and those factors can either help support you with your diabetes management or they can get in the way. So starting to recognize what helps and what might be hindering, and then being able to problem solve those barriers. Remember, change is a process and it doesn't start with action, and you may have to go through that process a few times. That's okay and that's normal. And so we want to keep up that motivation by recognizing that there are going to be ups and downs to this process, and that's going to be okay. What were the things that helped get you motivated before? What are the things that maybe trigger a downslide? Learning how to recognize and incorporate those into your plan. We want to set small, achievable goals following that SAG principle, establish some healthy habits, and really remember that small changes can have big effects. So each day, identify one small step you can take in the right direction for managing your diabetes. All right, here's my contact information if you need that. I've got both my email and our number here at the Diabetes Center. I'm happy to be a resource for you. Also, the American Diabetes Association, the American Psychological Association, all have great resources for diabetes management. I want to open it up to questions and make sure we've got some time for that. And you can use the chat box, or Gabe, if I see one there. Okay, here's our first question. I'm wondering if there are things that parents and other loved ones can do to help, and what doesn't help. It's a great question. One of the issues that comes up from time to time is people with diabetes will say, wow, I feel like my family becomes the diabetes police. They're always watching what I put in my mouth, how I do this, when I do this, and it just gets old. So always starting with a conversation, talking with your loved one about what's helpful, what's not helpful, what are their needs. Parenting kids with diabetes is a whole nother topic of conversation. I do have my own daughter who has type 1 diabetes, so this topic is near and dear to my heart. Some of this depends on the developmental age of the child. We always want to pay attention to what would typically developing peers be doing, and we want to try to help place the child first, think about what everybody else is doing, and then how do we make diabetes fit into that. There are a lot of different behavioral strategies, and I'm happy to answer kind of more specific questions about the parenting piece. But definitely things that don't help, nagging, tying, judgment to foods. If we talk about this is a good food, this is a bad food, we want to remove the emotional component from foods and try to just help stay within the meal plan and the general guidelines. There's a place for all foods. It's about moderation and making healthy choices. So those are a few things. Another question, How about severe substance use disorder that's interfering with diabetes management? Yeah, substance use is definitely a challenging issue, and it can absolutely interfere with diabetes management. Working with a mental health professional or your physician, depending on which substance use issue you're dealing with, and getting appropriate treatment will be an important part of getting on track with your diabetes. Any other specific questions that we have today? I can talk a little bit more about the substance use piece. One of the biggest challenges for individuals who are dealing with substance use is sometimes our routine can be negatively impacted. So getting into a regular healthy routine of good eating habits and physical activity can go a long way as you're working through the substance use. I can't say enough about physical activity. Physical activity is great on so many levels. It helps with reducing insulin resistance. It helps with overall glucose management. It reduces stress. It helps with weight management, and it improves mood. There are actually a number of studies out there that compare antidepressant use with physical activity. And for people who have mild to moderate depression, 20 to 30 minutes a day of good, vigorous physical activity tends to have similar effects to antidepressants. So absolutely important to include that exercise in our routine. Another question that just came up, how about good exercises for those with significant neuropathy? I'm so glad you brought that up. Neuropathy definitely makes exercise a challenge. Talking with your physician about the level of neuropathy and activities they would recommend you engage in versus avoid. For many people, pool work can be a good one. It helps with joint issues. It helps with some of the pain that they experience with neuropathy. If you're able to walk, walking is a great exercise. You can do it anywhere. You can do it at different levels. For people who have too much pain in their feet with that, sometimes using a stationary bicycle, especially a reclined bike. But when we talk about exercise, we actually talk more about movement. This is just about getting your body moving. It's not about going to the gym and banging out 30 to 50 minutes a day. If you're able to do that and you enjoy that, fantastic. But for many people, it's just about increasing our movement throughout the day. Things like planning to be physically active if you're a TV watcher when the commercials come on, standing up and doing some stretching during that period. Using resistance bands can be a good exercise. Even light weights, soup cans, whatever you have that's handy, we just want you moving more. Next question, what's the best way to address teens who struggle with depression and are non-compliant? Diabetes is really tough for our adolescents. They're struggling with all the additional issues of regular adolescence, and then you embed diabetes on top of that, and it can be overwhelming. I always recommend getting some professional help to assess the situation. So you can start with a school counselor. You can come see us here at the Diabetes Center. There's a number of community counselors. Even your primary care physician can administer general screenings for depression to kind of assess that level. Then once we've identified that that's what's going on, we can look at what's most appropriate treatment. We know that cognitive behavioral therapy is very effective in helping deal with depression. There are a number of medications for some individuals that can be helpful. But just in terms of what interventions can you do at home, staying engaged and activated in your life is one of the best ways to deal with depression. We call this behavioral activation. So helping your teen identify friends they like to spend time with, activities that they like to do, things that they enjoy, or if they don't enjoy anything anymore, just identifying things they used to enjoy can be helpful. And making a plan and a routine to actually look forward to some of those activities, plan those activities a couple days a week, keeping them engaged in their life. Someone else just asked, can you talk about bariatric surgery? There's a body of literature talking about this and that it can cure diabetes. This is a whole topic in and of itself, so it's hard for me to do this justice, but I can at least make a couple of comments here. The literature on bariatric surgery is increasing dramatically, and this is becoming a more and more common treatment recommendation for some individuals. It's important that you talk to your primary care provider and determine whether or not this would be a good alternative for you. I do have patients I work with here at the Diabetes Center who have had bariatric surgery. In some of those individuals, they do see a reduction in their diabetes symptoms. Sometimes diabetes recurs and sometimes it doesn't. So it's very individual, but this can be a good treatment alternative for some people. Regardless, you still have to make the behavior change to maintain the success and get the initial weight loss with bariatric surgery. So I always encourage people to work with a professional in those areas to change those behavioral habits first. It makes the bariatric surgery more effective and will help maintain those gains over time. What are the side effects from mismanaged diabetes? Are they permanent? So unfortunately, there's a number of negative complications that come with diabetes. This can include vascular damage, neuropathy, retinal damage. Some of these situations may improve with improvement in glucose management. It depends on the degree of damage and how long that's been there. So that's really a case-by-case basis, and it's important to talk to your provider about that if you're having side effects and complications from your diabetes. But the complications of type 2 diabetes are serious, and the better we can manage those glucose levels and the earlier we can manage those glucose levels, the lower your risk of side effects. So that A1C is a great indicator. All right, I've got about 2 more minutes that we can spend, and then I need to transition to my patient care time. I don't know if we have any other questions that have come in. And if not, I've certainly enjoyed spending this hour with you. Hopefully there have been a couple of points that you can take home about managing diabetes more effectively. Stay engaged, make those small changes, try to make the healthy choice the easy choice, and don't give up. And if you get frustrated, there's lots of help out there, so don't hesitate to reach out. Thank you so much.
Thank you, Amy. Thank you so much for presenting. And thank you everyone who attended. We do have a webinar in March specifically for providers, so please attend that if you're interested. That's March 14th. And please take time to do the evaluation at the end of this webinar. Thank you again. Have a great day.
Thank you.